For all things health and fitness, this is the Army Gymnastics Podcast.
The Army Gymnastics Podcast.
Discover a fitter, healthier you at ArmyGymnastics.com.
Welcome, everyone, to the Army Gymnastics Podcast. Today, we're diving deep into something really, really crucial. It touches so many lives. Diabetes, heart health, and hormones, basically, what you absolutely must know. Look, if you've ever felt just overwhelmed by all the health info out there, maybe even a bit scared trying to connect the dots, please know you are not alone in that feeling. Our goal with this deep dive is simple: to be your guide. We want to offer clarity, some actionable insights into these powerful links between diabetes, your heart, and those vital hormones.
That's exactly right. We get it. Navigating these complex health topics can feel, well, isolating sometimes. So our aim is to give you a focused exploration based on solid evidence, something that empowers you with real understanding. And to do that, we've gathered quite a bit of recent scientific research. We're talking the latest standards from the American Diabetes Association, detailed reviews on metabolic syndrome, specific studies looking at type 1, type 2 diabetes, heart health, and even the gut microbiome, which is fascinating stuff. Yeah, our mission here is really to pull out the most important, maybe even surprising pieces of information from these sources and present them in a way that's clear and actually useful for you.
Okay, fantastic. So where should we start unpacking this? Maybe that link between diabetes and heart health. It seems like a natural starting point.
Absolutely. It's fundamental. What the research shows very consistently is a much higher risk. We're talking cardiovascular disease and, sadly, mortality for people living with diabetes. Doesn't matter if it's type 1 or type 2. The risk is elevated.
And digging into that a little, I found something in the sources quite striking. For people who develop type 1 diabetes as adults, their risk of, MAC, major adverse cardiovascular events, and just overall mortality, it's considerably higher compared to the general population.
Yes, and it gets even more specific than that. The data actually points to adult onset type 1 diabetes carrying a greater risk of death from really acute things like diabetic coma or ketoacidosis.
Yeah.
More so than typically seen with type 2 diabetes.
Really?
Yeah, it might seem unexpected, but it highlights just how delicate that glucose regulation balance can be, especially when type 1 is diagnosed later in life.
That is surprising. Okay, thinking about catching things early before major heart problems surface.
Yeah.
The sources mention asymptomatic issues like structural or functional changes in the heart, stage B heart failure. So even if you feel okay, these silent changes could be happening under the surface. That's quite sobering.
It is. And it immediately brings up the question, right? How do we find these issues early? The guidelines do suggest screening using things called natriuretic peptides like BMP or NT-proBNP. Catching these early signs could be absolutely key in stopping the progression to, full-blown symptomatic heart failure, stage C.
Makes sense. And it's not just the heart muscle itself we need to think about, is it? Peripheral artery disease, PAD, affecting the limbs.
Exactly. That's another significant worry for people with diabetes. PAD. So screening for that is also recommended, especially for those at higher risk, using the ankle brachial index. It compares blood pressure in your ankle to your arm.
Ah, okay.
Yeah, so higher risk groups would be, say, age 50 plus, having had diabetes for 10 years or more, or having other diabetes-related complications already. Finding PAD early, crucial for maintaining mobility and just overall cardiovascular health.
And high blood pressure, hypertension, seems like that pops up a lot alongside diabetes.
Oh, it's a very, very common partner, unfortunately. And that's exactly why careful blood pressure monitoring is so stressed in the guidelines, not just at the clinic, but at home too. And doing it correctly matters.
How so?
Well, the technique. Sitting quietly for a few minutes first, feet flat, arms supported at heart level, little details, but they make a big difference for accuracy.
Right, getting reliable numbers. And what about those dizzy spells some people get when standing up? Is that related?
It definitely can be. Significant drops in blood pressure when you stand up might indicate something called autonomic neuropathy. Basically, the nervous system isn't controlling blood pressure properly, and that can actually influence what the right blood pressure target should be for that individual.
Okay, so we've established this really tight, complex link between diabetes and heart health. Now, let's shift gears slightly to this term we hear a lot, metabolic syndrome. You mentioned it earlier. It sounds like it sits right in the middle of all this.
You've absolutely nailed it. Think of metabolic syndrome as a cluster, a group of interconnected factors. We're talking physiological, biochemical, clinical, metabolic stuff, that when they all show up together, boom, They significantly ramp up the risk for both cardiovascular disease and type 2 diabetes.
Like a perfect storm of risk factors.
Kind of, yeah. Imagine things like high blood pressure, unhealthy cholesterol levels, too much fat around the middle, that visceral fat, and insulin resistance. Individually, they're not great. But when they combine forces, that's metabolic syndrome, and the combined risk is much higher.
So what are the main components of this cluster?
Okay. The key players are usually insulin resistance. Your cells just aren't listening to insulin properly. Then there's that visceral adiposity, the belly fat we mentioned. Also, atherogenic dyslipidemia, that's a fancy term for unhealthy cholesterol and fats. High triglycerides, low good HDL, maybe more small, dense, bad LDL. Basically, a recipe for artery plaque, elevated blood pressure, of course. And finally, a sort of low-grade, chronic, pro-inflammatory state throughout the body.
Interesting. And it sounds like different groups have slightly different ways of defining it.
That's true. You'll see definitions from the ADA, the WHO, AT+II, the IDF. They vary slightly in the specific cutoffs. But what's really important is they all emphasize that same core group of interconnected risk factors. And the IDF, the International Diabetes Federation, they make a good point about waist circumference. They recognize that what's considered high risk can differ between ethnic groups, due to body composition variations. So they suggest ethnic-specific cutoffs.
That makes a lot of sense, tailoring it. You mentioned inflammation markers like CRP and IL-6.
Yes, and this is important. These inflammatory markers are often elevated in people with metabolic syndrome. It's like the body is in a constant state of low-level alert. And importantly, even independent of the other factors like blood pressure or cholesterol, this inflammation itself seems to predict future cardiovascular events. It adds another layer of risk.
Okay. And insulin resistance, you said that's a core feature. Can we unpack that just a little more?
Sure. So insulin is the hormone that helps glucose, sugar, get from your blood into your cells for energy. With insulin resistance, the cells don't respond well. It's like the key isn't turning the lock properly, even if there's plenty of insulin around, sometimes even extra insulin. This messes up glucose handling, obviously, but it also triggers a whole cascade of other issues. Metabolic problems, vascular problems that really pave the way for atherosclerosis, that artery hardening.
And the dyslipidemia, the unhealthy fats, how does that fit into the metabolic syndrome picture specifically?
Well, the typical pattern you see is high triglycerides, low HDL, the good cholesterol, and often an increase in those small, dense LDL particles. They're particularly nasty for arteries. And insulin resistance is a major driver here. It affects how the liver and fat tissues handle fat synthesis, storage, and release into the bloodstream.
Got it. And one last piece from the sources on metabolic syndrome, a hypercoagulable state. Sounds serious.
It means the blood has an increased tendency to clot. This often goes along with that pro-inflammatory environment we talked about. You get higher levels of certain factors that promote clotting, which you can imagine further raises the risk of things like heart attacks or strokes, which are often caused by clots.
Wow. Okay, metabolic syndrome really does seem like this critical crossroads where all these risks meet. Now, let's pivot a bit. How do our hormones and just our everyday lifestyle choices play into all this?
This is really where things get interesting and also where we have a lot of potential influence. Think about chronic stress. When we're chronically stressed, our bodies produce more cortisol, that main stress hormone, sustained high cortisol. It can actually encourage the storage of that deep belly fat, that visceral fat. It can worsen insulin resistance and mess up our lipid profiles too, all contributing to metabolic syndrome risk.
So managing stress isn't just about feeling better mentally. It has real physical consequences for metabolic health.
Absolutely. It's deeply interconnected. And then, of course, there's diet and exercise. These are truly the first-line foundational treatments for metabolic syndrome. And you don't necessarily need massive changes. Even modest weight loss, say around 5% of body weight, can make a significant difference in blood pressure and related hormones.
And specific foods. Does what we eat matter beyond just calories?
Oh, definitely. Diet composition plays a huge role, especially with inflammation. Diets high in, say, saturated and trans fats tend to promote inflammation, whereas diets rich in fruits, vegetables, fiber, they seem to have an anti-inflammatory effect. The Mediterranean diet often comes up in research as being linked to a lower incidence of metabolic syndrome. Lots of plants, healthy fats, fish.
Right. And exercise. I assume it's not just about weight loss either.
It's exactly right. Physical activity works wonders, even without major weight changes. It can significantly improve insulin sensitivity, making your cells listen to insulin better. And it helps improve your lipid profile, your cholesterol and triglycerides. Both aerobic exercise, getting your heart rate up, like walking, running, swimming, and resistance training, lifting weights, building muscle, both are really beneficial. and just reducing sedentary time. Simply sitting less throughout the day helps too.
Okay, so lifestyle is key, but if those changes aren't quite enough to get things like cholesterol or blood pressure under control, what are the next steps, medically speaking?
Well, for dyslipidemia, managing those fats, the main goal is usually lowering the bad LDL cholesterol. Statins are the primary tool there. However, if someone has really high triglycerides, like over 500 mg/dL, the priority actually shifts. Then the main goal is to lower those triglycerides first to prevent a painful condition called pancreatitis.
Oh.
And there's another interesting point. For people whose LDL is controlled but triglycerides are still elevated, say between 135 and 499, and they're at high cardiovascular risk, a specific purified fish oil medication called icosapent ethyl might be considered to further lower risk.
Interesting nuance there. And what about blood pressure management, specifically in people with diabetes?
Yeah, the targets are often a bit lower, generally aiming for below 130/80. Lifestyle changes are still foundational, of course, but medications are often needed. There's several classes: ACE inhibitors, ARBs, diuretics, beta blockers. The choice depends on the individual. There are other health conditions, there's specific risk factors, and potential side effects, including any metabolic effects the drugs themselves might have.
This is all incredibly useful. Okay, let's move into what feels like a really cutting-edge area now, this whole gut-brain metabolic axis. What on earth is that?
Yeah, it sounds complex, but it's a super exciting field. It's basically recognizing the profound role that the trillions of microbes living in our gut microbiome play in our overall health. Not just digestion, but our metabolism, our immune system, and potentially even our brain function and mood.
Wow, so it's way beyond just breaking down food.
Oh, absolutely. These gut microbes produce all sorts of compounds, metabolites that get absorbed into our bloodstream. And these compounds can travel around the body and influence how we process energy, how sensitive we are to insulin, inflammation levels, you name it.
And if the balance of these microbes gets thrown off, that's dysbiosis.
Exactly. Dysbiosis just means an unhealthy imbalance in the gut microbiota. And we often see specific patterns of dysbiosis in conditions like obesity and type 2 diabetes. Researchers are working hard to figure out which specific bacteria are changing and what those changes mean functionally.
The sources mentioned short-chain fatty acids, SCFAs. Are they good guys?
Generally, yes. SCFAs are produced when our gut bacteria ferment dietary fiber, the stuff we can't digest ourselves. And these SCFAs, like butyrate propionate acetate, seem to have really beneficial effects. They can improve glucose control, influence gut hormone release, even help maintain the gut lining integrity. So fiber feeding your gut bugs is important.
But not everything the microbes produce is helpful, right? I saw mentions of TMAO and LPS.
You're right, it's a mixed bag. Some microbial products are less desirable. TMAO is one that's produced from certain dietary components like red meat and eggs, processed by gut microbes than the liver. Higher levels have been linked to increased cardiovascular risk in some studies. And LPS, lipopolysaccharide, is part of the cell wall of certain gut bacteria. If the gut barrier is leaky, LPS can get into the bloodstream. This can trigger inflammation systemically, a state sometimes called metabolic endotoxemia, which isn't good for metabolic health.
Okay, so the gut is talking to the rest of the body metabolically. How does the brain get involved?
The gut-brain part. The gut-brain axis. It's this constant two-way communication highway. Nerves, hormones, immune signals. We know the brain influences gut function. Think butterflies in your stomach when you're nervous. But the gut also talks back to the brain. And this is where it gets really interesting for metabolism and even cognition. For instance, insulin isn't just for the body, it acts in the brain too, influencing things like appetite and cognitive function. And there's emerging evidence that problems with brain insulin signaling are linked to cognitive decline, like in Alzheimer's disease. And guess what? The gut microbiome might influence how sensitive the brain is to insulin, potentially impacting cognition through these complex pathways we're still mapping out.
That is absolutely mind-blowing. The idea that gut bacteria could be influencing our thoughts or memory.
It really is paradigm-shifting stuff, and the discoveries keep coming. For example, one recent study suggested a link between inflammation down in the colon, possibly driven by the microbiome, and an effect all the way in the pancreas. Specifically, it seemed to increase the growth of insulin-producing beta cells during obesity development. It hints at this novel signaling pathway between organs, like the liver talking to the pancreas via the gut.
Wow. It's like uncovering this hidden layer of conversation happening inside us. Any other really surprising new findings?
Well, another really intriguing line of research is focusing directly on the brain's role in blood sugar control. They've identified specific neurons in the hypothalamus, called AGRP neurons, that seemed to become hyperactive in diabetic mice. And get this, studies showed that if they could normalize the activity of just these neurons, they could actually normalize high blood sugar levels in the mice. And this happened without necessarily making the mice lose weight. Yeah. It challenges the traditional view that high blood sugar in type 2 diabetes is solely a consequence of peripheral insulin resistance or beta cell failure. It suggests that the brain might be a primary driver, or at least a major player, opening doors for potential brain-targeted therapies down the line.
That completely flips the script on how we might think about type 2 diabetes. And wasn't there also a new gene discovered in the liver?
Yes, PPP1R3B.
Yeah.
Bit of a mouthful. But this gene seems to be a key switch in the liver. It helps determine whether the liver stores incoming energy primarily as glycogen-stored glucose or as triglycerides fat. And that decision has direct downstream effects on your blood sugar levels and blood fat levels. So variations in this gene could influence someone's individual risk for type 2 diabetes and fatty liver disease. It really opens up exciting possibilities for more personalized nutrition advice based on genetics someday. Precision nutrition, essentially.
This has been just incredibly enlightening. We've covered so much ground, from the heart to the gut to the brain. If we had to boil it down, what are the absolute key takeaways you want our listeners to hold on to from this deep dive?
I think the biggest message is just how interconnected everything is.
Yeah.
It's not separate buckets. Diabetes dramatically raises heart disease risk. Metabolic syndrome is often the bridge connecting them. Our hormones, our stress levels, our daily lifestyle choices, diet, activity, they profoundly impact this whole system. And this emerging science around the gut-brain metabolic axis, it's just adding incredible new layers to our understanding of how these complex systems talk to each other.
So really understanding these links, these connections, it gives you, our listener, the power to make more informed, more proactive choices about your health journey.
Exactly. Knowledge really is power here.
For expert fitness advice and personalized plans, visit ArmyGymnastics.com, your go-to resource to reach your goals. Start your journey today at ArmyGymnastics.com.
And maybe just one final thought to leave you with. Considering this incredibly complex dance between our genes, our lifestyle, our gut microbes, even our brain activity in shaping our metabolic health, what's one small evidence-based change you could explore in your own life? Something manageable, but aimed at positively nudging this intricate web of factors in a healthier direction. Something to think about.
Thanks for listening. For all things health and fitness, subscribe to our newsletter today. Find out more at ArmyGymnastics.com.